Welcome back to another episode of the Braun Performance and Rehab Podcast. Joining me today is Robby Donnelly and Dr. Jason Scopp. The three of us are going to be discussing Robby's journey following his second ACL tear, in addition to medial and lateral meniscus tears, which resulted in a ACL reconstruction via a patellar tendon graft, a lateral meniscus transplant, and a medial meniscus repair. Robby was able to successfully return to his goal of playing lacrosse and was able to play lacrosse over the summer and is now in the process of gearing up for fall ball. This was made possible through the work of Dr. Scopp and his team from a surgical standpoint, in addition to regular check-ins with Dr. Scopp and his team throughout the rehab process and the village of people that it takes to get someone back successfully from one of these injuries, from athletic trainers to strength and conditioning coaches to other physical therapists, to family involvement, teammate encouragement, and beyond. This is certainly a case of an individual who did not let what happened to him define him, but instead to choose his own destiny and forge his own path forward. I also really appreciate the fact that we were able to have both Robby as the athlete and Dr. Scopp as his surgeon on the podcast at the same time. And I think this gives a really great, unique understanding of the entire process following an ACL injury, from initial injury all the way back up to return to sport. And I think that if you're an athlete who has faced an ACL injury or are currently rehabbing an ACL injury, this will offer you a lot of great insights and advice from two people who have faced this injury a number of times themselves. Really appreciate their time and hope you enjoy this episode. This episode is made possible by our sponsor for Season 5, ISOFIT. ISOFIT is my go-to way to help athletes win more and hurt less. Enjoy. Robby, Dr. Scopp, welcome to the podcast. I'm super excited to work with you both today. Thank you so much for being here.
Thanks, Rob.
So obviously, the three of us, we've gotten to know each other pretty good over the past several months, and we've gotten to collaborate a little bit on, working together with Robby that way. But for people who might not be familiar with the story and the journey that you've been on for the last about year or so, Robby, would you mind filling them in a little bit about who you are and all the, things that have happened for you? And then Dr. Scopp, if you wouldn't mind kind of telling people about what you do over there, the great work you do at POA, the team you've got around you that way and all that way.
All right. So my name is Robby Donnelly. I play lacrosse at Salisbury University, and I am entering my junior year. So I've had the pleasure to meet Dr. Scopp and Dan from an unfortunate series of events that took place. During my freshman year, right at the end of the season, I ended up re-tearing my ACL that I had already torn in the past. And Dr. Scopp was the team doctor, and I got introduced to him and able to meet with him about moving forward, because it's always my ultimate goal to play college lacrosse, and I wasn't going to let it end after getting re-injuring that knee. So I had the pleasure of meeting him, and then I went home for the summer after surgery, rehabbed with my PT from home, and then when I got back down to school, did some more rehab, and then instead of ending early at the pre-stage of rehab, I wanted to continue going to get myself back and do like athletic rehab, and I was told to reach out to Dan, so I had the pleasure of working out with Dan for the course from January all the way till May. And when I get back to school, I'm planning on continuing to work with him just for sustainability stuff. But yeah, that's my story and where I'm at right now with everything.
As an orthopedic surgeon and sports medicine doctor, I've been here in Salisbury since 2003 and have been taking care of the Salisbury teams since I got here. Obviously took a special interest in Salisbury lacrosse as I've been covering them I think I've been on the sidelines as Berkman's longest standing compatriot, but I don't think he ever realizes that. He thinks it's just my first season sometimes. But and really have developed a good, strong relationship with a lot of players over the years as they kind of take the journey from injury to return to play. And as a sports medicine doctor, one thing I can say that is probably a little unique to me is I've had just about every injury I treat. And so I've torn my ACL 3 times and had 4 shoulder surgeries. I've had, a myriad of various things. So I kind of understand the despair that an athlete undergoes when he gets unraveled from his sport and his fitness, his or her sport or fitness. And then the journey that is not a linear journey, but it's a psychologic and physiologic journey back to, health, but then back to return to play. And then as far as like creating a system around you, I'm fortunate enough to work with people like you, Dan, who have the same mindset where we talk about, there's PT, but then there's PT, which physical therapy, but there's also PT, which is performance training. And you can't do sports medicine without an athlete and without a true performance enhancing, athletic minded physio like Dan is. And so when you have that system in place, that really allows us to, increase the performance of our athletes and trying to get them back to play, not just over the injury, but actually getting back to a higher level of function.
Yeah, I mean, you both brought up so many amazing points there. And just to kind of run it all back, I mean, first, Dr. Scopp, I feel like your ability to relate to athletes, as you mentioned, you've gone through so many of these injuries yourself, whether it's shoulder, knee, whatever it is that way. And to your point, the ACL journey and recovery is something that is very, very taxing on the athlete from more than just the physical recovery standpoint. For about 9 months, your locus of control is literally ripped from you, and you have to wait to be told when you can jump again, when you can run again, and all these different things. And, before your injury, you could just do that stuff whenever you wanted to. So it's certainly a challenge that way. I agree. But I think having a provider that can relate to that struggle and relate to that challenge firsthand is very unique and very helpful that way. The other piece you mentioned about that teamwork approach that way. And, I feel like there's so many people that were involved in Robby's rehab and Robby's recovery that way. And I don't know the names of all of them. I haven't met all of them, but it really takes a village to kind of get the outcome that he was after and that he was able to get that way. So I know he worked really closely with PTs at POA. I know he worked really closely with ATs at Salisbury University, PTs back home, strength coaches at home and on campus that way. And, having a good outcome and a good recovery that way is really a team effort, and it takes a lot of different people playing important roles. And it's not really a one person show to it, so to speak. I think that the more everyone collaborates together, the better the outcome is for the athlete. And at the end of the day, that's the most important here, the athlete. And I think third, Robby, as you were talking, you shared that this was your second ACL tear. And it's something where a lot of times people can come back from an ACL tear and get back to sport, but it's a lot harder the second time around, especially when you know that, well, I've already been here before. I already know this is going to be a grind. I've already done this grind. Why did this happen to me? Now I have to do this whole thing again. And not only that, but I believe, correct me if I'm wrong, but I believe there was some additional stuff that occurred with your meniscus. And that was part of the reason that you sought out Dr. Scopp in particular from a surgical standpoint, because a lot of other providers weren't willing to do it, correct?
Yeah, so I'll start with, first time was right before senior year. I ended up tearing my ACL and a partial tear in my lateral meniscus. And that was like you were saying, it's a huge mental battle, huge physical battle. And just doing it one time is like one of the worst experiences ever, but you learn a lot from it. You build character. And so I got over that, made it back for the time to move in down to school, played the entire fall, and then played the entire spring up until the last regular season game. And right when it happened, I jumped up to catch a pass and came down, landed, and I knew instantly that something was up. So the second time, it was re-tearing the same knee, as well as the lateral meniscus and medial meniscus. And on the lateral one, which I believe was the one I tore partially tore the first time, was totally wiped out and just gone. And my journey with figuring out the right person to go to figure it out, because like I said before, my lifetime goal was to play college lacrosse, and I did not want the road to end there so fast. So I wanted to make sure I found the right person to help me and have belief in me that I could get back out on the field. So I went to 2 surgeons prior to talking with Dr. Scopp, and both of them gave me the answer of, your knee, like, this injury is so extreme and we don't believe it's possible, or we don't think you can play lacrosse at that level after going through another surgery at this level. So I immediately was like, okay, cross them off my list. I don't want to work with them because they have no belief in me, because I think I can definitely do it. And then me and my parents got to meet with Dr. Scopp, and he, like he said before, he's been through these injuries. So he knew where I was coming from about how much you want to get back. Like, I believe Dr. Scopp's told me multiple times that he's very stubborn himself and wanted to get back to work when he shouldn't have, and it ended up being a problem too. But so he understood where I was coming from, and he was very personable with the whole thing and had full faith and belief in me that I was able to recover from this surgery and get back to where I am today. So that is my ultimate reason why I went with Dr. Scopp, and I couldn't be happier I made that decision.
Dr. Scopp, I know, from a surgical standpoint, a lot goes into managing these kind of injuries that way, from, the concept of meniscus transplant in a
Right.
college level athlete that way, in addition to just the fact that it was a second ACL. So obviously, there's only so many tendons we can pull from that way. So what was your kind of approach, and where was your head at from the surgical side and surgical standpoint on Robby's case that way?
Yeah, I mean, I think, Robby hit the nail on the head. I think the most important thing when I see, especially in a revision situation, is, understanding the athlete's expectations and then reality, and then trying to kind of merge the two. But as a preservation surgeon, when we're thinking about a second ACL or a third ACL, we don't want to do the same thing and then expect a different outcome, right? And so we've got to sort of change the system a little bit and look at the other reasons why the knee failed. And so whenever I talk about revision ACLs, I always say, is it a surgeon problem, a patient problem, or just bad luck? And so when I look at that, and I looked at Robby's knee, I said, well, here's the deal. I mean, you really don't have much lateral meniscus left. Lacrosse is a very strong cutting sport that really relies a lot on the lateral compartment or the outer compartment of the knee, and not having that meniscus really puts at risk for sort of secondary stabilizer issues. And so we say, all right, well, we got to manage this meniscus. And I'll tell you, there's not a lot of literature out about athletes getting back to that high level of function on a meniscus transplant. And so when we talk about sort of how to preserve this knee, obviously my goal is to have Robby have a good knee in his 20s, 30s, 40s, 50s. But I would love to be able to say, yes, you can do sports as well. And you're always afraid. I mean, it's just like if I think I use this metaphor a lot. You get a car accident, you get your car fixed, and you can get in an accident literally as you're pulling out of the driveway of the body shop. And so the same thing can happen again. And so when I was looking at Robby's knee and what his goals were, I say, listen, man, we can get your knee good. Getting back to sports is a philosophic journey that we also have to kind of take together, and you just have to take in all the information around you, and then we can maximize everything as far as getting it as good as it can be between with you, Dan, with the support staff of the support staff at the school, but also your family. I mean, it's not fun, it's not easy to go through this, and I think the biggest thing that happens, or the biggest hurdle, is this feeling of vulnerability that you've gone through it. It's like you don't want to go through it again, and your body is almost rejecting you, and you're like, man, I'm a freaking high performance vehicle here, and now I've got this little kink, and I don't want that, and so it's like you feel a little more humble by the injury, and that's we can spend as much time as we want always talking about how we transplant meniscus and what graft I use and how I optimize ACL revisions. But the most important part and the final piece of the puzzle is getting over that vulnerable feeling. And that's the final discussion that sometimes a lot of people leave out when you're talking about getting back, whether it's a high school athlete all the way up to a pro athlete. Everyone goes through that same feeling of vulnerability, which just kind of it sucks.
It really does, and it's interesting you bring that up because Robby, I know I didn't know you at this point, but I feel like you told me a lot about those first like 3 or 4 weeks after surgery and how things kind of locked up on you at first, and we started from a little bit of a rough place that way, but then things kind of took an upward turn for you, and it's one of those things that knowing sometimes it gets a little bit worse before it gets better. And that you have to stay committed to the journey that way. I think it's essential because, again, I think you told me it kind of got real tight and stiff, but you were able to kind of work through it and push through it. But it was a grind for a while.
Yeah, so I did surgery down with Dr. Scopp in Salisbury, and I live in New Jersey. So after the surgery, spent the night and then went again in the morning before I headed home. And then I had to sit in the back seat with my leg propped up for a 3.5, which should have been a 3.5 car ride that turned into like 4.5 because of traffic. And then, so right then and there, the first 1.5 to 2 weeks, my hip was locked in place. So there's just that factor of being uncomfortable and already having to deal with the fact that I'm on crutches and can't do much for this entirety of the summer. So there's 2 huge mental things. And then, of course, the mental thing of I did this already, and now I'm in this situation again and have to do it all over again. So, of course, the first, I'd say almost month and a half were the most challenging for me, just to get back and face reality that I'm in this position again and realize that my goals are what my goals are. So there's nothing I could do now besides put my head down and keep going.
You had mentioned before that your mom is a PT. So was she able to kind of provide, Dr. Scott brought up the family support side of things. I'd imagine family support was a lot stronger for you when your mom literally understands the rehab process herself that way.
Yes, of course. My mom was there both times and helped me at home do more than I needed to do. Like, just like keep on me with everything. Like, yeah, of course, she's my mom. So we had a couple battles here and there, but she was looking out for the best of me. And yeah, that definitely helped. And I'm very happy and fortunate that I had that to add on to everybody else that was there for me and helping me out through this whole thing.
I'd imagine, Dr. Scopp, you probably see a huge difference in outcomes based on an athlete's support system. And the more support they have, the better their outcome is. But I'd also imagine for you, having gone through this yourself and seeing, hundreds of athletes a year that way in practice, you kind of realize that those first 4 to 6 weeks can really make or break the rest of someone's rehab. It could either set them up really well, or they could fall really far behind from a range of motion standpoint, or things kind of tighten up and become fibrotic, for lack of a better way to put it. And it can really kind of derail the whole rest of the journey, I feel, for people.
Absolutely. I mean, it is always a mystery and amazing when you do if you can do the exact same surgery on 5 different patients, and you can get 5 different outcomes. And when a patient is not an active participant in their recovery, it's really a challenge. And with ACL, it's so critical from day 0 of being able to obtain full extension, for example, getting the leg fully flat. And so when you see someone walking around who had their ACL done and they're slightly bent in their knee, or they don't have full extension, or their patellofemoral joint is tight, it's usually, as much as I hate to say, it's usually a patient issue because they didn't do what they were supposed to do, or they weren't told to do what they were supposed to do. But when you start seeing those things, the patient has to be an active participant and not a passenger in the recovery of these surgeries, whether it's, even if it's just a simple knee scope, all the way up to a crazy revision with meniscus transplants. They got to buy into it and do stuff that they don't want to do when they don't want to do it.
Is there anything that you've found that helps get patients to buy into that active process? Because I've noticed a lot of the times, like at least on my end, I almost feel like more of a cheerleader in the first few weeks than a PT, because it's just a matter of getting people to do the reps and put in the volume and the work that it takes to kind of bring things back, more than there's a skill component to it, but it's more of like, I only have 45 minutes with them two or three times a week at best. So in that situation, I feel like the patient motivation factor, as you mentioned, is huge. How do you go about getting people to buy into that from your standpoint, or getting into that active process, so to speak?
Couple things, one is a lot of follow up, especially early on. As Robby mentioned, we see patients post-op day one, and then there's a sort of method behind the madness of that, because it sucks. Your knee hurts, you don't want to get out of bed, but you get out of bed, you've got to, and it makes it so you don't kind of mope around and feel sorry for yourself, and it shows that you can move, and you need to. And then we see usually 7 to 10 days later, then we get you into PT. We get patients right away using pedals on the floor, Pedlar it's called, and then really a self-management program kind of right away, so that close recovery is important. The other things that we do, sending patients their pictures kind of online. I think when you see the digital pictures, it's kind of cool. They see kind of what they did, they can share it with their friends, and kind of be engaged in the process. But the grit that happens to an ACL tear with an athlete, I say, it's either the beginning of the end or the end of the beginning, because you really can come back stronger. And I'll tell like a 15-year-old, I'll say, you never expect anything bad's going to happen in life, but this is your first sort of experience of that. And sometimes this is pushing you into a direction of a career even, right? So I try to motivate somebody who never really thought they might end up in medicine, for example, or a physiotherapist or an athletic trainer, or something, that there's something good that can come out of something bad. And I also say, at the time of the injury, when I'm giving them the bad news of their ACL tear at the office meeting, I say, you get to mope around for one day. I give you till sunrise tomorrow. So you can be pissed off today. You can, feel sorry for yourself, but tomorrow you have to figure out how you turn this into something, good, or how you're going to get through this. The second part of what you're saying, with physical therapy, like you said, physical therapy is the minimum you should be doing. Like that's just guiding you. The rest, you really have to be doing something every day. And so when I see someone who is getting stiff, not moving their knee, and I'm starting to get worried about them, you have to have this sort of motivational discussion. Say, listen, you don't get your legs straight, you're going to have more surgery. I got to break up adhesion, scar tissue. So sometimes you have to do a little fear. And then even despite all of that, there's still people who slip through the cracks, and you see it as I do, where they don't do what they need to do, and then things kind of get worse, not better, and then you have to end up doing an arthroscopy and break up scar tissue. And I had to do that yesterday on someone who is 3 months out, and they're lacking full extension. And so it's identifying, my side is identifying problems before they be small problems before they become big problems.
Yeah, no, I think that's a great point. And it's so funny you bring up the method to the madness that way, because I keep hearing all these stories about people who come in for their, day one follow-up, and they come in to PT a week or a week and a half later, whatever it is. And they go, yeah, on day one, I went in and I saw this really tall guy named Gabe, and he made me lift my leg up and down from the table.
Right.
And I was like, and you did it. And they're like, but it freaking hurt. And I was like, but you did it. And it's kind of shifting that focus on in those first few days after surgery. I think a lot of people struggle to realize what they're actually capable of, and how strong they really are mentally, and what they can do if they push themselves a little bit. I think that getting people to realize that early on is essential to that long-term buy-in that way. On Robby's side of things that way, once you kind of transitioned out of that early stage rehab, once you were able to get off the table and start walking around and moving around and kind of doing more of like the typical closed chain exercises and that sort of thing, the cool stuff, so to speak. How did that process go for you from a rehab standpoint? I'm kind of picturing like summer through like, December, January, that way of 23, this would have been. What was that process look like? How did it go? Who are the key people involved that way? Walk me through that if you wouldn't mind, Robby.
So what was different the second time around than the first time? I obviously worked with Rob from POA, which is Dr. Scopp sent me to, which I loved Rob. He was awesome to work with. He did things different than I did the first time. I never used the BFR the first time, and he introduced me to that, and I hated that thing. That was the worst experience ever. Yeah, nothing about that is fun. No. But I'll tell you what, that thing, I know why it's used. It is awesome. I felt it helped me a ton with increasing my strength and everything at a fast rate. But yeah, that whole fall, which was right when I got off my crutches, the rehab there was a grind for sure. But the worst part about it was BFR, but I received so many positive results from everything. And the whole time, like every day I went, we increased it, no matter whether it was the amount of power or restraint it had on me or with other exercises. We were able to move through the program of things I was allowed to do pretty quickly and at a very successful rate, which I don't know, I was very happy with the whole thing. And yeah, it was a good first couple months of rehab, I thought.
Yeah, no, I think that's so interesting that you bring up the BFR, because that's something I continue to see time and time again being seen in these case studies, and clinical pearls that way is just proving how effective it is at bringing back muscular strength in a short amount of time. And I think it's really perfect for the ACL rehab when, we don't necessarily want to put high loads on tissue early on, because there is a tissue healing that needs to take place, and we have to respect that. But we also need to realize we have to do things to get stronger, and we have to do that quickly. So I feel like the BFR is perfect for that. And I think, Dr. Scopp, that was something you used extensively in your own ACL rehabs as well, correct?
Yeah, so just for the translation, BFR, blood flow restriction, cuff gets placed on your kind of your upper thigh that restricts the blood flow. And so when you're doing even just straight leg raises, it becomes very anaerobic very quickly. So you have to think, we're taking grafts, right? So we have to make your ACL as something. So, we usually, best we can, if we have access to it, want to use autograft or your own tissue. So whether it's your quad or your patellar tendon. So we're already, just by doing surgery on that leg, shutting down the musculature of that leg. And then it is an uphill battle getting it back. And so blood flow restriction therapy allows us to jump that into high gear and really skip ahead and prevent a lot of the kind of decompensation that can happen immediately post-op. So I went through it as well and hated every minute of it. But there's a weird sort of thing that I guess all of us athletes have, is we kind of like pain, and pain is in my opinion is just another sensation. Hot, cold, happy, sad. Pain is just something there, and sometimes pain, it can be a motivating thing. So when you're doing these things and you're like, wow, that really freaking sucks, instead of saying, I don't want to do it, say, I want to do 10 more. And then it's getting that mindset right away. So you're already, from the jump of therapy, exhibiting this sort of athletic mindset. But yeah, I can't run right now and cut, but I can actually take that same mindset of being a bullheaded athlete and apply it to, doing more than I'm told to do and embracing the suck. I mean, that's really what it comes down to. And that's a good thing to sort of give an athlete something to overcome right away.
I can see why you get along so well with the lacrosse population, Dr. Scopp. That's that's a very big carryover to what I see there a lot of the time. What kind of things were you looking for at, follow-ups in that time from, second ACL and meniscus transplant, are there any things that you look for from a criterion standpoint at follow-ups?
Oh, yeah.
Any specific things that way that you really try to key in on? Or
Well, first of all, everything could go wrong, right? I mean, you have to look at each surgery as a potential problem, right? A revision ACL, is one problem. A meniscus repair, which Robby had on the medial side, that's another problem. And then a meniscus transplant on the lateral side, well, that's another problem. So, of course, incisions, you're going through a knee that already had surgery, so scar tissue. You don't want any infection. You need to create an environment of healing. And once all those things are happening, then we start looking critically at like motion, for example. A criteria that I look for, almost like this untold metric, like from a therapist standpoint, if a patient comes back with a tight patellofemoral joint, I'm already worried about the therapist or the athlete not doing their things, because the patellofemoral joint is such an important part of mobility of a joint. And so with Robby, we had to restrict him to 90 degrees of motion for 4 weeks, because too much bending of the knee puts stress on the back of both meniscus. So we had to protect both the medial and lateral meniscus. So high risk for stiffness. And so that's when we have to make sure that everyone's on board, and having Robby's mom kind of on board with that as a therapist. And then Rob Dawson at POAPT, first phases of therapy, being aware of that, Robby being aware of that, and then us looking for those things at the post-op. And then typically at the 6-week mark, I can tell which way it's going to go, as far as stiffness. So that's my number one, like, fear of these revision surgeries, is really a kind of stiffness problem, and identifying that early.
Like we talked about earlier, if you can get that range of motion back, a lot of other things really fall into place. It's just a matter of getting it back quickly and making sure that, the initial foundation for the rest of the rehab has been set up correctly that way. Now, Robby, obviously, I got to know you in the January timeframe, throughout the spring that way. And I kind of have my own interpretation on things and how that went and what we did. But I really want to hear your thoughts. What do you feel like we did? What do you feel like we accomplished in the spring? How do you feel like we were able to do that? Just walk me through kind of your interpretation of that 4 to 5 month period that way.
So right when I got there, we did some testing and everything. And obviously I knew a baseline of where I've been in the past, like whether it was like weightlifting stuff or just plyometric numbers. And right when we did most of those numbers to start it out as a beginning test, they were not where I was used to or where I wanted to be. Obviously, coming after this surgery and not training at that level yet. So yeah, that's going to happen. But I knew right away, like, I still had a lot to do. And you knew too that there was still a lot to work on. And we took that and moved on with it. And honestly, you made me work my ass off, whether it was doing stuff with you twice a week or the programs you would make me, and I was working with talent as well, that you would make us, and we would actually stay strict to and push ourselves to get through. A lot of the things that I thought helped was all the isometric stuff. Like, they were up there with BFR. I've done them in the past, but they suck as well. But there's a lot of positives that come out of them. I thought that helped get my strength up fast. And just looking at I had to use the biodex chair with Matt Lipka at the or at our athletic training at Salisbury, just so we could see as my numbers keep increasing. And by the time I took my last test before I went home for the summer and finished my work with you over the spring, my right leg was at such a high number compared to his baseline of where athletes are when they get cleared. My right leg blew that out of the water, and my left leg was baseline he was using was 1400 total work, and my left leg was at 1600, which is already way past that. And then my right leg was at 2000. So both legs were extremely strong and way stronger than they were when we started. And they were already way past his baseline for where he typically sees athletes on that chair, which I was super pumped about. And a lot of it was, of course, working with you and then putting in time doing everything and staying strict on myself.
Bring up an interesting concept with referencing the chair or the biodex there, Robby. And that's, everyone's always looking for the numbers or the formula as far as like, what does it take to get an athlete back to sports safely? What numbers, what criteria should we look for? And, it's interesting because I don't think we have figured out the magic bullet of tests, or I don't think we have, any like grouping that we can have an athlete hit a certain set of numbers and know for 100% certainty that they'll never re-injure again. I just don't think we're there yet, but I think that having the, strength foundation, especially of the muscles at the knee, the quads and the hamstrings, is essential that way. But there's a lot more to it than that. Dr. Scopp, from like a return to sport, return to performance standpoint, what are the typical kind of numbers, metrics, battery things that you look for from a testing standpoint? And do you ever look for anything extra or additional outside of kind of like the, general test that you look for that way? Or is there any other like new tests that might have come out in the past few years that you like from a research standpoint or anything that way?
Yeah, I mean, like you hit the nail on the head. I mean, there's no universally accepted metric. It's putting a whole bunch of things together. So that's why, I'm so particular about what, PT my athletes go to, because I really want to make sure that it's that you're using the criteria that you see that you're comfortable with, so you can assess and then report those information to me. And so what I like to see is, the first sort of baseline testing, because sometimes, when I tell a patient, oh, it's gonna be 9 months to a year, and they'll say, well, why, what's the variability? It's like, well, the variability is on you, because, at 9 months, you're going to be good if you're good, but if you're not, I like seeing that like 9-month test, and then it's saying, you know what, you're only at 83% or whatever. And so you can really focus those deficits on that last phase of recovery. And so from my standpoint, I like my therapist to communicate to me and then also with the patient, so the patient has the expectations of where they need to focus, and by not surprising them, so doing testing at whatever interval you like, and then whatever kind of battery of tests that give you the information you need. So then what I do is, when I see the athlete back at that 9-month or so visit, I do a couple things just in the office. I like to do like and I don't cue them, but I like to do a jump hop test. So first I just kind of say, just do a jump squat. And I just like to see if their knee kind of caves in, but I don't tell them that I'm going to do that. But that's what I'm looking for. So if at the initiation of it, and I see their knee drop in and they get this dynamic valgus, I'm like, all right, this is, this in my head, I'm like, we're going to have an issue here. And then I make them do a jump hop, just on our little stool in there. And that really accentuates it if it's a problem. And then I communicate that with the patient, saying, this concept of modifiable and non-modifiable risk factors, right? Dynamic valgus, or not having the whole sort of system teed up for sport, is modifiable. We can take care of that. I can't take care of the fact that you might slip on, turf field, 2 days back returning to play and re-injure your knee. That can't be modified, but I can control the stuff I can control. And so I look at that whole thing, the things that my therapist tells me. I love the numbers at that visit, so I can communicate that with the patient. I like the patient knowing that when I ask him, I'm like, well, what percentage did, Dan tell you? And he's like, I'm at 86%. I know I need to focus more on my, hamstrings and my glutes. And I'm like, all right, good, game on. And then then if there's a goal, like if they're at 9 months, they're like, well, lacrosse starts or fall ball starts, September 15th. I'm like, all right, let me see beginning of September. Dan will retest you then. And then I see you, and we've got time to work on these deficits. And then hopefully by this date, you're going to be good. And then of course, we do other things. We get braces and things like that. And braces are just more of a reminder to the athlete that you need to cue your leg. It's not going to stop you from re-injuring. There's a misconception that an ACL brace is going to be protective. It's not. It's more of a mental cue that, hey, this is the knee I had surgery on. I really have to pay attention to firing, just triggering my glutes or triggering my core, triggering my, secondary stabilizers before I, put my foot down. And I notice it myself. I mean, I had this, I had my first ACL done 2000, God, I think it was 2010. I tore it in Alaska backcountry skiing, and then I had it reconstructed, and then 4 months post-op. This was before this 9 to 12 month concept. Robby, it used to be like at 4 to 6 months, you would go and we'd let you go without any testing. And so at 4 months, I had already had this plan to climb Mount Rainier. And I was just like, well, I'll do it by 4 months. I'll do the work. And all the testing that was available then, I was like, I was good. So I went and did it. And I never forget, like, it was like we left, like the summit day was like almost like 23 continuous hours of climbing, from, with crampons and every step, crampon are spikes that stick to, the surface, right? Which is the worst thing you could do walking down on an ACL knee, because you're causing translation. And I will tell you, if the one thing that got me through the climb is I literally, however many million steps it was that day, like, thought about every step with my left leg. And that was, that was what kind of got me through it. Now we don't do that. And I didn't re-tear it that way. Like, I did great for a bunch of years, but the now ACL rehab has changed so much, and we get so much more data, but you still can re-tear. It's just, there's nothing you can do about it.
No, you're absolutely right. And I think on the testing side, the important part you brought up was you have to test consistently. You have to see the trend in numbers, because there's been times when I see athletes improve their symmetry, but their numbers went down. And it's like, okay, yeah, we're more symmetrical, great, but why are we not getting as far? And then it becomes a whole separate conversation. So it's certainly one of those things where I think our concept of return to sport testing and criteria is ever evolving. And I know, Robby, for you, we did a lot of different things. I think that the hop, single leg, triple hop, crossover hop are all pretty much staples at this point. And I think it's a combination of distance, but also how does it look and how does it feel in the moment? And this is something that I see so often missed in the sports med world, is we only care about the number. We only care about the objective side, but how does it feel to the athlete? Because if they tell you it doesn't feel right, then, at the end of the day, we have to take that into account and consideration. And if we're ignoring that, then we're doing the athlete a disservice. We also do a lot of jump testing here, and I like the vertical for height, just as like a quick metric of double leg power output. But then we also do a single leg vertical, and I'll do it counter movement, non-counter movement, different things that way, just to get a further appreciation of that left to right, side to side difference. And I find a lot of times there's a big drop in vertical power output in athletes after ACL surgery. And I think that we have to spend more time on the vertical vector than the horizontal vector a lot of times. Obviously, then, you did some biodex testing, which I think has so much value in metric. I know people are trying to get away from it, but I do really like the isokinetic data that way. And then on top of that, I like the quick and dirty single leg squat test, which I'm sure you might still have nightmares about, where I give you a dumbbell of 50% body weight and make you max rep left versus right to a box. But that's just to show me how strong you are in a brute strength, brute force kind of situation. And especially for a sport like you play, Robby, with lacrosse, you got to be freaking strong. I know you wear pads, but I think all of us realize that those pads don't really protect you a whole lot.
Those pads have gotten smaller and smaller over the years, man.
Yeah, for sure.
And I mean, really, your physical strength is your best body armor for sport at the end of the day. And the other piece, I guess we got to, end or conclude with this, is your case, Robby, is a testament that it is possible to take, as we've talked about, a really unfortunate situation and turn it into something incredible, a situation that a lot of people would have counted out from the start and said, well, it can't be done. It's not possible. You mentioned you met with other surgeons at different institutions who said, no, you can't do this, or it's not going to have a good outcome. And it's nice for you now to be on the other side and prove them wrong. It's interesting for me too, because I reached out to a few different PTs around the time we started working together, asking, hey, has anyone ever worked with someone second ACL and meniscus transplant before? And everyone said, no, I've never seen it. Or if I have seen it, they don't get back to sport. They go for a recreational run every now and then. They exercise a little bit, but return to sport in meniscus transplant, second ACL, and medial meniscus repair, that just doesn't happen, is what a lot of them said. But you were able to prove a lot of people wrong. And I think that's a huge testament to, one, your work ethic and the grind that you're able to commit to for literally a year, the support system that you built around you from your friends, your family, your ATs, PTs, strength coaches, and so on that way. And obviously to Dr. Scopp and his team's ability to provide from a surgical standpoint a high quality intervention, but also the ability to walk with you every step along that way and keep you motivated, encouraged, and bought in.
Yeah, I want to
I agree.
that, I'm just a cog in the wheel of that whole process, Robby. You definitely are the very impressive with the way you've kind of come through this. And I know I always say I'm always worried, and I will always worry about your knee, and it's just the way it is. But it's definitely a testament. Here this whole thing is about you. As Dan and I are just along for the ride. You're the one who has been able to put this all together and get yourself back to where you are. So I congratulate everything you've done, because you've definitely impressed everyone around you.
Thank you. But yeah, like Dan said, there's a lot of people and a lot of stuff that went into all of this, and I couldn't be happier to say I've made it through. But yeah, it's journey of continuing to keep doing what I've been doing and make sure that I don't let anything slip, because I'd rather continue getting stronger and continuing to keep my leg in the best possible case it could be for the being able to keep up and play at that high level of lacrosse, because I'd want nothing more than to be able to finish out my collegiate career and not have any other problems with anything.
Yeah, no, that's a great thing, Robby, and we want that for you. But there's definitely someone listening to this right now who's going through a similar situation to what you experienced 8, 10, 12 months ago from this point. What's your message to other people who have kind of been where you are? Maybe they're recovering from that ACL injury, first one or second one or something like that. What's your kind of message to the broader public, or for the greater good, I guess I'll say?
I mean, my best message that I could give out to anybody that's in a situation like this or anything in the same sort is just, you got to know what your goals are and what you're willing to do to achieve those goals. And if you're serious about achieving those goals, you got to make sure you're willing to get through this process, because it's a very long process. Like you said, I've been doing this for a year. And my plan is to continue doing sustainability stuff. And all summer, I'm still, quote unquote, rehabbing it. But yeah, it's gonna, as long as you want to achieve your goals, you got to be willing to put forth the effort to do so. And there's going to be some tough times, some bad times, but that's like what everybody said about a good support staff. I don't think I would have been able to do it without the support staff I have between you guys, my family, my PT, Christian from home, Matt Lipka, Rob, everybody. Just, I don't think I would have been able to do it without everybody, because they keep me in bright spirits, but they also push me and know that I can work towards it. So just having that, I'm going to get through this mindset, is the best advice I can offer.
Yeah, no, definitely. That, coupled with what Dr. Scopp talked about earlier, from patient motivation, getting motivated, getting bought into this process of using this as an opportunity to get better and come back stronger, and viewing it as an opportunity as opposed to a setback. It's the craziest thing, but a lot of people look at me and tell me once they've gotten to the other side of their ACL rehab and they're back to sport, that they're thankful it happened to them, and it was one of the best things to happen to them, because they kind of find themselves and learn so much in the process, which seems crazy to me, because I don't know if I would, tear my ACL, if I would be like, oh my gosh, I'm so glad this happened. But you guys might be able to relate to it from the
Mhm.
process of kind of building back better and stronger than you were before and enduring hard things for a prolonged period of time. I think David Goggins calls it like carrying the boats or something like that.
Yeah, I mean, I think that sort of that armored mindset, or as Jocko Willink says, in his little 5-minute thing about good, when bad things happen, that's good because you don't really realize your potential as a human being until it's tested. I don't like when people are sitting here talking about how strong they are over there, but they've never been tested. But when you come back, someone like Robby who's been tested, it really shows what your potential is, as opposed to just what I call t-shirt or bumper sticker sayings, and so I think, Robby, you hit the nail on the head, and I think you've got a good philosophy about how to handle this, and that's what's gotten you this far. So what are you going to do? Life-wise, career-wise, has this pushed you in a direction or
Well,
away from it?
I'm not gonna lie, during the second time going through the whole thing, I had thoughts of rethinking everything, but I never ended up going forth and moving towards the medical field. But as of right now, still sticking as a finance major
Yeah.
and wanted to do wealth management, asset management, financial advising one day. But yeah, as of right now, nothing's changed, but I definitely thought about it for sure.
Yeah, but you have the mindset that most people in your field, won't have. And when you hear people kind of whining about something, you'd be like, man, you've had no idea what mental, strength is. There's no such thing as motivation. It's all about discipline, and you've demonstrated it. So
That's an awesome point to kind of wrap up on that way. For anyone listening who wants to find out more about either Dr. Scopp, you and your team and your practice that way, Robby, you and all the amazing stuff you do on the lacrosse side, and obviously the legends of Salisbury lacrosse that way, where can they find out more about all of y'all at?
No, I mean, peninsulaortho.com is our website, peninsulaortho.com, but I'm not into self-promotion. I just, I'm just here to take care of people. So I want you to have the last word, Robby.
My Instagram's r.donnelly10. I'm sure it'll be tagged on Dan's post. But yeah, I'm excited for what's to come in this upcoming season and the next years to follow.
That's awesome. That's awesome. We'll link to all of that in the description below. That way, if you didn't quite catch it, you can just click there. Dr. Scopp, Robby, I really appreciate your time and for everything you guys have done together over the last year. And again, proving that it's possible to take a terrible situation and turn it into something really incredible. So great work to both of you guys. And thank you for all the work that you all are doing.
And good work to you, Dan. We couldn't do this without you.
Yeah, thanks for having us on.